Goeiedag, good day, fellow South Africans and citizens of the world. And I'm starting to feel like a modern-day Sina van Rensburg, but I'm only joking, okay, guys? It's just common sense what I give out there. And what I said over the last couple of weeks is that the public hospitals are going to be the melting pot where the coronavirus will find a very happy home to infect lots and lots of innocent people. Look at the situation they have. Waiting rooms, people coughing, and they're all pushed in together. It's just recipe for disaster. But St. Augustine's Hospital in Durban was shut down this week because of the number of coronavirus cases, especially among the staff. Nearly 50 members of staff have the coronavirus at that one private hospital in Durban. And I said that, look, it's only a matter of time before it starts appearing in other public hospitals, where it already probably is. But because of the way they do their tests and their shortage of test kits, it just hasn't been identified. Well, it has been identified in another hospital now. And this hospital is facing a lockdown. And this time it's a public hospital. The Public Servants Association is calling for the temporary closure of Durban's Inkosi Luthuli Central Hospital after a nurse allegedly tested positive for COVID-19. On Thursday, the Public Servants Association, or PSA, demanded that government temporarily close the hospital immediately to avoid the virus spreading, like it did at Netcare's St. Augustine Hospital. According to the PSA's Mlungisi and Ndlovu, they received complaints from members regarding a patient who allegedly did not follow screening protocol at the hospital. Well, she probably wasn't told what to do. That would be about right. Ndlovu said, "This person went through without following the correct process. We received info of a case where a member contracted COVID-19, and we want the hospital to be temporarily shut down to ensure that every frontline worker is tested to prevent the spread of COVID-19. The union further claimed that 40 members of staff have been placed in quarantine. According to patients, it was business as usual at the hospital on Thursday. A woman who asked not to be named said she had been screened before entering the hospital. She said everyone inside seemed fine. Someone did mention that a ward was being sanitized and cleaned ahead of the arrival of COVID-19 patients from another hospital, but no one said which hospital. Another man said he had been taking his mother to hospital for her treatment, but did not hear anything about a nurse being tested positive." Spokesperson for the Department of Health in KwaZulu-Natal, Noluthando Inkosi, said only the Minister of Health, Dr. Zweli Mkhize, is authorized to confirm positive cases of coronavirus. Now, this is where the problem is, okay? Because of the draconian censorship laws that this ANC government have brought in to cover their own backsides, it's got to come officially from the health minister or the president when it comes to reporting on the coronavirus, which has basically zipped the lips of the media in South Africa. They can't discuss what is actually going on. If they do, they could be charged with a criminal act. And the ANC government is a pariah. South Africa has become a police state, which is a bit weird because it's already a gangster state. Anyway, let's continue with what they're saying here. Furthermore, both Premier Sili Zikalala and KZN, or KwaZulu-Natal Health MEC, Nomagugu Simelane Zulu, have adopted a stance that the names of patients, hospitals and areas affected by coronavirus, the so-called hotspots, will not be divulged. Get that? Clusters. Clusters are where several people in the same area, like St. Augustine's Hospital, have been infected with the coronavirus. And what the MEC, the health MEC for KwaZulu-Natal, is now saying, that the so-called hotspots or clusters will not be divulged to the general public. This is absolutely ridiculous. This is censorship in the extreme. This is modern day South Africa. Anyway, this is to prevent the stigmatization of patients, families, health facilities, unless they are extenuating circumstances, and communities. People who are affected by COVID-19 need our solidarity, care, and support, not discrimination. Well, that kind of flies completely in the face of having a lockdown. You have a lockdown so people can self-isolate, they can make sure they stay away from anybody who's infected, but no, these geniuses, these friggin' ANC geniuses, they're hopeless, they're a lost cause, but they think they're geniuses. Now they're going to deny the right of people knowing that their neighbor has got coronavirus. So they'll walk up to their neighbor, interact, and because he probably won't self-isolate and won't say anything, and bang, they get it. And with these clusters, someone might be living in that area with the clusters and go out there, and next thing they've got the coronavirus and wonder why. This is absolutely ridiculous. But it's the old L factor, missing in action. There's so many examples of this, it's ridiculous. Anyway, she went on to say, government is focusing on demystifying the novel coronavirus so as to create awareness about the virus, what its symptoms are, as well as what those who display them need to do. Also important is for people to heed the instructions of the lockdown and stay at home. We call on the media to support these efforts. Now, what she's saying and what she's doing are completely in conflict with each other. In one hand, she's saying, we're not going to reveal where the clusters are. So by not revealing where the clusters are, as I've just said, people who are within the parameters of the cluster have a good chance of picking up the coronavirus because they are not aware that there is a coronavirus cluster in the area they're residing. And in townships, that is extenuated because you have multiple families often living in one shack. That's the reality of the situation in the townships. Think about it. It's a powder keg. And then the other hand, she's saying, this is why we need to keep the lockdown going. Well, if people are going to spread the virus from one family to the other in the townships, and it's just going to spread through the whole community, because you're denying people the right to know where the virus is or where the clusters are, then the ANC government are clueless, which is self-evident. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. Above all, please stay safe.